Hi, my name is Dr. Alberto Callejas from Clinica Avant. Today I'm going to share with you some information about treatments with injections of ozone gas. For this treatment, what we do usually here in Clinica Avant is to use the results from X-rays or MRIs and from the physical exam to determine the number of points per area that we're going to inject. Following this, we disinfect the skin and proceed with the injections. The first injection is usually a combination of an anesthesia called procaine and vitamins. And then after that, without pulling the needle out, we just change syringes and inject a small portion of ozone gas. In some instances, we can also inject hyaluronic acid if it's available and the person needs it. And then after that, the person can start to mobilize the area treated, and we can inject all kinds of inflamed or painful areas in the body, like ankles, knees, hips. We can inject ovaries, we can inject prostate in men, we can inject discs in the back, elbows, wrists, shoulders, necks, or any area that has been traumatized and is painful. Side effects of injections with ozone gas can be a temporary feeling of pressure in the area injected, but this feeling of pressure will usually go away in 3 or 4 hours after the treatment. Another side effect possible is dizziness right after the injections. So each session you might feel dizzy, but this is also temporary. The number of sessions that a person needs depends on the chronicity and the severity of the problem. You could need anywhere from 4 sessions up to 10 sessions, sometimes even more, sometimes even less. It varies with each particular case. So this treatment with ozone injections, we use it for people with trauma, like pain from accidents, falls, localized infections like abscesses, different trauma and joints, tendons, ligaments. We can help those with this treatment, which is a very good treatment for these problems. Thank you very much. Alright, so we're ready to begin injecting the ozone gas into these ladies' knees. The knees have been disinfected and then marked, and now we proceed to inject. So we need to adjust the position of the foot so that the knee is about really square, 90 degrees. Right. We're going to begin with this one. And we're going to start with the deep knee joint injection first. Okay. Let's see where the entrance is. Okay, it's right here. The entrance is right here. Okay, so I'm going to inhale. Inhale. Right. Out. Perfect. Now we inject a few millimeters of this liquid, this mixture. We need to inject that. Need to make. Alright, so that's it for the liquid. Now we use one of these little tools so that we can switch. Alright, perfect. You can hold this up. And let's start with the gas. Here's the gas, and we're gonna inject a few cubic centimeters of this ozone gas into her knee. She's gonna feel no pain with the injection, she will probably only feel some pressure because gas exerts some pressure inside the knee. So here we go. We're going to need at least 10 to 20 cc's in this deep injection. Let's see. Alright, we got about 15 cc's there. Let's see, let's push a little bit more. And now, yeah, she has about 20 cc's now. We get it out, and that's it for the first point. Now we're ready to inject the deep point in the second knee. Let's make sure the leg is about 90 degrees right there. We find the entry point. Ready? Right here. Inhale. Out. Perfect. That is the perfect spot. So we inject first the liquid mix, and when we do that, then we inject the gas. Okay, so here we go with the second knee. Push the gas in. Right. Okay, so we're injecting some of the trigger points in her knee. These are actually more superficial points. Not inside. We're not inside the joint, the knee joint. This is it's more superficial points that we call trigger points. We're injecting these. She has many trigger points around her knees because her condition has been progressing for a very long time. So she has pain in most of her tendons around the knees. Injecting the liquid portion, and after that we inject the gas. We're going to inject about 5 cc's in each trigger point, from 5 to 10 maybe. Out. Okay, so inject the liquid first on this trigger point. Now we inject the gas. Put some gas in there. 5 to 10 cc's is plenty. Sometimes when you inject, you will see that, especially when it's a superficial point, the skin will plop up. It will look like a blob. Okay, she got about 10 cc's on that point.